Qualified, professional, and compassionate doctors talking real solutions to real health problems.
Good evening. Thank you so much for allowing us in your rooms this evening for your week's favorite health talk show, the Doctalk show. We are here to talk issues to do with your health because we know once you're healthy, then that is a big platform for you to become wealthy. This show is brought to you by National Medical Stores and Camelin Mains Collection, and in conjunction with Quiz Mali Production House for anything to do with videography and photography and documentaries. Dr. Joseph Gavin Nyanzi is your host tonight, and with me in studio tonight is a medical doctor, pediatric cardiologist, to put in simple terms, a doctor who has specialized in treating heart diseases for children. She works with the Uganda Heart Institute. Dr. Judith Namuyonga, you're welcome to the show.
Thank you so much. Thanks for having me here.
Wow.
Yeah.
And that simply means that we're going to be talking about the heart, but tonight very specifically about children, the heart and the children. What are the dysfunctions of the heart that manifest in children? Dr. Judith, there are quite a number of problems that come with children's hearts.
Yes.
When they're still in the womb or when they're born. Please take us away. The floor is yours. Ugandans are listening in tonight.
Thank you so much, Gavin. I'm so delighted to be here this evening speaking about something that is right at my heart.
Wow.
So children are predisposed to so many heart diseases.
Yeah.
And before one becomes a child, they are fetus. So they must be conceived
In the mother's womb.
in the mother's womb.
Okay.
So some of the diseases that children get, they are born with them, and we call those congenital heart diseases.
Okay.
So by the time a disease is manifesting in a child, an adolescent, called a congenital heart disease, they must have been born with it.
Okay.
So from the time of conception, errors happen by around 1 month of age.
Okay.
Because the fetal heartbeat is recognized, or the fetus's heartbeat is recognized by day 19 of life.
Okay.
And by that time, if the mother's womb was not prepared, her body system was not prepared to receive a baby, things start going wrong.
Wow.
And so by around 20 weeks, that is 5 months of the pregnancy, there are already heart defects that are manifesting. And these can still be recognized, as we'll discuss later in the show. So congenital heart diseases, a baby is born with them, though most of these are recognized late. And even when one is an adult, they can still have a congenital heart disease that could probably be subtle and is not picked up early.
Okay. Dr. Judith,
Yes,
is
please.
it a big problem in Uganda?
Of course.
Okay.
It is a big problem. So congenital heart disease has a prevalence of about 8 to 12 per 1,000 live births.
Wow.
So if you
It's quite
convert
huge.
so in a year you have about several children that are born with heart disease. The numbers, I may not point down to those, but every day at the Uganda Heart Institute, in a day, out of, say, the 25 patients we see in a day, about 8 or 9 of them will have a congenital heart problem.
That is a
That
huge
is diagnosed,
number.
confirmed on echo, and confirmed by our tests that we do.
Wow. So it's a big problem in our community.
It is a big problem.
Okay.
Number 2, there are other diseases. So that's just congenital.
Congenital.
Then
Somebody is born with it.
With it,
Okay.
yes. And it presents at any time.
Okay.
And also in the fetus it will present.
Okay.
So there are other diseases that happen in children that we call acquired heart diseases.
Okay.
So you're born well,
Okay.
without any heart problem, and then these come on board. Number one is, and the most prevalent, is rheumatic heart disease.
Okay.
So rheumatic heart disease, as we usually say and as we usually teach in the medical schools, it's a disease of the poor that comes because of poor living conditions, congestion, as we'll talk ahead. Okay. So rheumatic heart disease, secondary to an untreated group A strep throat. So there is a sore throat that would affect children aged 5 to 15 years. Okay. And if not treated rightly, that sore throat would end up as a rheumatic fever, which is a form of fever with joint pains and all those things as we'll discuss. Okay. Now, rheumatic fever complicates with a chronic form of rheumatic heart disease, which is a valvular heart disease.
So if it's not managed in time, this fever or this infection can affect the heart.
Yes, it affects the heart valves of the heart. And also sometimes the myocardium, or the muscle of the heart, which we call the pumping organ of the heart, the muscle itself, or even the sac of the heart, the pericardium. So rheumatic heart disease could manifest that way through rheumatic fever. And another one that is subtle that could actually happen to anyone, and also adults, is we call them cardiomyopathies. Okay. Oh, they come as viral infections, viral diseases, you know, flu-like illness, and in about 3 weeks' time, these children present with body swelling, fast breathing, temperatures, and they get what we call a myocarditis. Now, that can be aggressive.
The muscle of the heart is affected?
Yes, it gets inflamed.
Okay, so
inflammation, yes, it can't pump well, the heart has fluid around it. So that's also not nice, but it happens in the children.
Okay. How serious is the rheumatic heart disease?
Rheumatic heart disease.
At the Uganda Heart Institute, those you see.
So rheumatic heart disease is also quite common. There may not be so many, but the ones that present to us actually present with advanced disease. That's the unfortunate bit of it. So because people elsewhere in the lower centers will treat the children that present with rheumatic fever as malaria. So they present generally with joint pains, joint swellings. Initially the diagnosis was migratory joint swelling, that maybe you'd have one joint swelling, and as this one heals, then the other big joint gets swollen. As this one recovers, you get another bigger joint. But now there are newer guidelines. Of course, most of the guidelines are coming up together with American Heart Association, the World Heart Federation, of which we are members of the World Heart Federation. So there are guidelines for highly endemic settings and low endemic settings. And rheumatic heart disease is mainly in the low-income countries. It's a disease of the poor. In the US, you'll not find a lot of rheumatic heart disease. You'll actually see like one patient in 6 months who presents with rheumatic-like heart disease, which is not actually the typical that we see in Uganda. So the patients that come with advanced disease in heart failure, they're swollen, they're failing to breathe, the valves are already damaged, and that's when somebody actually recognizes and says, oh, this could be heart disease. And yet if they picked it early, this would
of course, you've mentioned about a number of clinicians in the lower settings not picking it up, but could it also be that actually many of the people out there do self-medication? They think when I get a fever, I just get a paracetamol, I just get something. Could that also be another big issue, self-medication?
Yeah, I totally agree that our practice in Uganda is actually not the best. People self-medicate, there are pharmacies all over, drug shops, so people will go buy paracetamol, ibuprofen, and yet one of the treatments of rheumatic fever with arthritis, what we call arthritis, the joint swelling or joint pains, is use of drugs that we call the NSAIDs, non-steroidal anti-inflammatory drugs, which include ibuprofen, endomethazine, you know, those are all over on open market. So when one takes those drugs, that will actually mask the disease.
So somebody will feel okay, yet
they get fine and cure a bit of the joint pains, and yet the immunological reaction is still happening that damages the valves.
Okay.
Yeah.
We've talked about the acquired. Can you give us some examples of the congenital, those that a child is born with,
Yeah. So the congenital heart diseases are also grouped into two types.
Okay.
The ones that we call cyanotic, a blue disease or blue man's disease.
Where the baby
is
turns blue. Okay.
Or some are actually subtle. You may not see the obvious blue color,
Okay.
but if you measure the oxygen saturation, you're able to pick low oxygen saturation. So oximetry is actually something very good that we could use in most of our hospitals, just to take a pulse oximeter of every newborn and see how are the oxygen levels. Are they low? Are they high? Are they adequate?
And actually
so one
now
picks
in
that.
the era of COVID, everybody knows what a pulse oximeter is. Something that is very common language everywhere.
Oh yeah.
Yes.
Oh yeah. So cyanotic heart diseases could be, and we have one that is common. The most common is called Tetralogy of Fallow. It's made up of 4 things. In that one disease, there is a hole in the heart. Then there's one blood vessel that takes oxygen to the lungs that is underdeveloped. And then the right side of the heart is a little bigger. So tetralogy, 4 things. The French used to call it malady, the blue, something like that. So this is a blue disease. And then in Uganda, what appears to be the second most is called Truncas Arteriosus. This baby is born with just one main vessel in the heart. Instead of having 2 different great arteries, the aorta and the pulmonary, they have one big vessel. And so for congenital heart diseases, you realize that, oh, this baby's heart development ended at this stage, when these blood vessels should have divided and then split and changed and twisted. So some of them fail to split. So for truncus, they fail to split. Others split and then they fail to twist, which we call transpositions. But the most common are the non-blue diseases.
Non-blue diseases.
The holes. Usually there are holes in the heart, holes in the lower chambers of the heart, holes in the upper chambers of the heart, holes, maybe some vessels that have failed to completely close. I must mention one hole that is due to a blood vessel that may fail to close, which we call the patent Doctalk arteriosus. Now that particular one is associated with premature deliveries, because you know, as the baby is term, this vessel should close. But when they are not term, it remains open. And we've had a lot of premature deliveries in Uganda. We actually wrote a paper, and one of the reviewers was asking, why? Why are you having premature deliveries? So mothers are not getting antenatal care early. They are having fetal diseases, for instance, genetic abnormalities. So these babies come out quite early. Viral diseases and infections in the mothers. One of them is rubella. Rubella, and we don't actually have a vaccine for rubella under the UNEPI. Which could actually prevent some of these, like the PDAs, all those things. So if we had that, that would be prevented.
Amazing. You've talked about prematurity predisposing to some of these,
especially the PDA.
Some of these congenital heart diseases. We're going to take a short break. You're going to pick it up from there and let us know any risk factors and that could predispose somebody to this, and whether these can be actually prevented. Thank you. We are still here with Dr. Judith Namuyonga from the Uganda Heart Institute. And please catch us on our YouTube channel as well as Facebook channel, the Doctalk Show. If you have any questions, leave them in the comment section below. Share this link with your family and friends so that they can get this information. We are taking a break and we'll be back in a moment.
The Ministry of Health informs the general public that amidst the difficult times of the pandemic, routine immunization for all children under 5, those eligible for HPV vaccines, and women of childbearing age is still going on in all our health facilities. Parents and caregivers, take all your children for immunization as per their schedule. All vaccines are safe, effective, and free. Remember to observe the COVID-19 prevention measures as you go for immunization services. Wear a mask properly, covering your mouth and nose. Wash your hands regularly with soap and clean water, or use an alcohol-based sanitizer. Maintain a physical distance of at least 2 meters from others and avoid crowds. This message is from the Ministry of Health with support from partners.
You are watching the Doctalk Show.
Sometimes
You are watching the Doctalk Show.
Thank you for keeping it here with us. In studio tonight is a pediatric cardiologist, and we are discussing heart diseases of the children. Please share the link, the Doctalk Show on YouTube and Facebook. Let your friends enjoy and let them come and learn about this very important issue. Dr. Judith, before we broke off, you were mentioning some of the predisposing factors to congenital heart diseases.
Yes.
The acyanotic or the non-blue diseases.
Yeah.
And you talked about the patent Doctalk Arteriosus.
Right.
And you were mentioning about the issue of poor antenatal seeking behaviors.
Yeah.
Please pick it up from there, and more other risk factors for these diseases.
All right. So, of course, we know that previously and currently our antenatal seeking behaviors are late. Even the land present late.
Yeah.
By the time they recognize they're pregnant, they're about 4 months pregnant.
Wow.
4 months pregnant, and they're not, some people conceive on a previous pregnancy, you know, they've just delivered a baby, then they never get into their menstrual period. The next time they realize they're pregnant.
Oh.
Yes, and they've not planned. So, and remember I said by day 19, we have a beating heart.
A beating heart by day 19.
And so if things have gone wrong, they've gone wrong. So a lot of things happen in antenatal care, and in actually very well developed countries, they start planning early.
Okay.
So you start, you're looking for a baby, then your obstetrician or gynecologist will tell you, well, we need to start taking these pills 3 months before you're pregnant. So you start on prevention, and by taking drugs like folic acid.
Okay.
Okay, so that reduces congenital heart diseases by about 80%. So if a mother takes folic acid antenatally, they change their habits, and I'm coming to the risk factors of congenital heart diseases. So if this mother has been drinking lots of alcohol, has been smoking, has been using all sorts of drugs, marijuana, all those things are a risk factor for congenital heart diseases. Yeah, so if such a mother wants to have a child and prevent congenital heart disease, one would be lifestyle change.
Okay.
Stop drinking alcohol, stop smoking, do not use marijuana, and all those drugs.
Wow.
And this should be 3 to 6 months. I would say for our African countries, it should be 3 to 6 months prior to conception.
And it's very sad, but actually, I don't know whether it's because of globalization, but actually you find young ladies taking marijuana. In the past, it was a thing of some men, but now, instead of being some men, most young men, even the young women, which is very sad.
It's very sad, but I think some things have pushed the young people to take all sorts of drugs. They're failing to cope up with stress and so many things, and therefore, in their wild behavior, they conceive not prepared for a pregnancy, and then they end up with all sorts of things. So those risk factors are key. Number 2, as I mentioned, premature deliveries caused by anything, maternal infections, urinary tract infections, malaria in pregnancy, all sorts of infections that would affect the mother in pregnancy can easily cause an early release of a pregnancy.
Wow.
And some of them, if they happen before 7 months of pregnancy, then you call that an abortion, right?
Yeah,
before 28 weeks. So a lot of things would happen. And now we have actually centers that are managing, we have hospitals in our country that are managing preterm deliveries that are even 7 months or 6 months, and this baby is actually taken care of.
Wow.
But most of them, because as I said, there are certain things that happen towards the end of the pregnancy. And one of them is the Doctalk Arteriosus, that channel, that vessel that connects the pulmonary artery to the aorta, begins to decrease in size towards term.
Pulmonary artery, would that be the right side to the left side of the
Yes,
heart?
to the left side.
So
of the, and
it's supposed to close.
Yes, it's supposed to reduce in size and close 3 days postnatal after the baby is born.
Oh, okay.
Okay? So if a baby is born early, before term, then that tube will remain open. Because the mechanism of closure is that there will be these muscles that are within that vessel begin to infold and then reduce in size and close by 72 hours after birth. So if it doesn't, then there will be channeling of blood from a higher pressure area to a lower pressure area. And some of them do not close actually.
Wow. Something that is coming out very clearly from Dr. Judith's presentation, and it has come out even from previous presentations on this show, the importance of antenatal care. And it's not just a mother's role, but the role of the husband, the role of the sister, the role of the brother. We need to really put in a lot of effort to make sure that our mothers get quality antenatal care. Yes, Judith, please. You're still taking on the risk factors.
So I'm still among those. So I've mentioned premature deliveries. And now among the others, genetic predispositions. So one has genetic abnormalities that happen. You know, we've been fighting COVID-19. And remember that when we got a new strain, they said it mutated. It underwent a mutation and changes. So there are genetic predispositions that happen, and things go wrong in the genes or in the chromosomes that certain babies are predisposed to them. And one of them could be, one of them that is most common in our setting is the Down syndrome. So if a fetus has features of Down syndrome, which our sonographers can pick on the basic biophysical profile that is done. You know, if you go for antenatal early, they will do a first scan. And we always recommend mothers to have at least a first antenatal visit before 3 months of pregnancy. So there they will do a first scan, and these people, the sonographers that do...
Sonographers, you mean the people who do the ultrasound?
The ultrasound. Of course, they are headed by radiologists and all those. So they will do a scan that will recognize subtle features that will suggest, oh, this fetus probably has congenital abnormality. One of them is they will report thickening of the knuckle area, which we call the knuckle translucence, will be a little thicker. And there's at the back. So actually, one of the indications for checking a fetus's heart when they're in the stomach or when they're in the uterus is what the sonographers have picked or what the biophysical team has picked in the first trimester. They also, oh, this baby has thickening here, or this baby has an abnormality, we are missing maybe a limb, we are missing something, we are seeing a smaller kidney. So anything that is congenitally abnormal is an indication
for you to
us to check the baby's heart while in the uterus. And it's something we are just going to actually start up at our center, at our hospital, at the Uganda Heart Institute.
Now you're trying to get me ahead, but I'll bring it on. So you mean at the Uganda Heart Institute now you're in position to check the heart of the fetus, the baby while still in the womb?
Yes, we are going to. We've actually started now.
Oh, that's amazing.
So about 2 weeks ago, last week, we were able to check.
Very good development. Wow.
So able to check that.
That is good for the Ugandan babies.
Yes. So one of those would be the genetic predispositions. And also the other, if one of the parents or the parents have had a child with a complex congenital heart disease, then they're more at risk of having another. So you also want to check at their next pregnancy, is this baby at risk of a congenital heart disease? We can check that.
So if I've had a child with a heart problem, then when in my next
complex heart disease.
A complex heart disease. So in the next pregnancy, it's very important for us to really visit the cardiologist so that we check.
Especially the blue disease. Especially the blue diseases. So that's about the congenital heart diseases. But remember I told us about the acquired heart diseases.
Yes, acquired.
The poor man's disease.
Poor man's disease, yes.
So rheumatic heart disease actually has risk factors. As I said, it's people that are predisposed, are living in congested areas. You know, the house is poorly ventilated, no windows. Everything is packed. The chicken are sleeping in the same house, they are cooking in the same house, everything is happening in the same house. So they are prone to having thrive or to help, what is the organism? Streptococcus group A Streptococcus can thrive in that kind of, yes, it's a bacteria that can thrive so well in that kind of environment. So they'll get a sore throat, and if it's not treated well, they end up with rheumatic fever, joint pains, fevers, swellings of the joints, and if not treated well, they end up with a chronic valve heart disease, which is rheumatic heart disease.
Okay.
Yeah.
Any risk factors for the myocarditis?
Yes. For the myocarditis, it's just a flu-like illness. And as we know that also in the era of COVID-19, COVID-19 affects actually almost all systems.
Yeah.
And I'll still just talk about the children. In the children, they'll present with a subtle myocarditis, some kind of abnormal function of the muscle.
Okay.
So any child that has been predisposed to that, you really want to check the heart and see how it is squeezing. Other centers like abroad in the US and in Canada, they actually looked at children who had that, and some of them had coronary artery involvement. Coronary arteries are the ones that supply blood to the muscle of the heart.
Okay.
So some of them would get narrower, and then that would affect obviously the squeezing of the heart.
Wow, this is so empowering, and I hope it's the same experience that is watching us over there. We're going to take a short break, but we'll be back, and Dr. Judith will be telling us more about the heart and our children. Keep it here. Share the link. In case you have any question, please leave them in the comments below on our Facebook channel and YouTube channel. See you in a bit.
You are watching the Doctalk Show. You are watching the Doctalk Show.
Thank you for keeping it with us this evening. Those that have just joined in, we are in the studio tonight discussing children and the heart. And in studio with me is Dr. Judith Namuyonga, a pediatric cardiologist working with Uganda Heart Institute. Wow, Dr. Judith.
Yes.
So much information this evening. So how do I know as a mother or a father that my baby has got this condition? Is it able? Am I able to tell when the baby is still in the womb? What should I be looking out for as a parent?
So well, you can be able to tell.
Okay.
From in a born child, you can be able to tell. In a baby, in a child, adolescent, you can be able to tell. In the fetus, somebody has to pick this up. Okay. And as I mentioned, the biophysical profile will either pick what we call fetal tachycardia, baby's heart rate is fast, or baby's heart rate is low, or baby has some kind of hole, because they will do the basic looking at the heart. They will look at the heart in its 4 chambers, or they will say this heart has a hole, or there are 3 chambers here, or something is not right. So at that point,
in other words, for the unborn babies, it's dependent on the doctor.
Yes, it's dependent.
And for the mother, it's important they do antenatal care early enough.
Yes.
Do an ultrasound.
Yes.
Mothers watching out there, do an ultrasound before the 20th week of your baby.
Preferably before 3 months of pregnancy.
Wow.
And that helps also calculate the most accurate date of delivery.
Okay.
But also will identify certain heart things quite early, and they will refer them to a fetal cardiologist to do the echo.
Okay. So for our born babies and all the way to adolescents,
So for the born baby, if it's a non-blue heart disease or a cyanotic heart disease, this may not be picked up quite early. The non-blue heart diseases usually present around 6 to 8 weeks after birth, and that's if there are significant holes or big holes in the heart. And so around 6 weeks, if the baby has, say, a big hole in the lower chambers of the heart, that baby will present with fast breathing. So they breathe a little faster than the newborn.
Wow.
So usually we know that a newborn to about 2 months of age, they'll breathe at 60 breaths per minute. They're usually faster than the adult.
Of course.
The adult is about 18 to 20 breaths per minute. While the baby is, so they breathe a little faster than their usual, which is the 60 breaths per minute. Number 2, you may also see indrawing of what we call the subcoastal recession. So just below the rib cage, you will see as the baby is breathing, there's an indrawing. The tummy goes in, they go in.
Yes.
Of course, we must learn to differentiate this, and this again comes back to also the health workers that receive the babies, because not everything that causes fast breathing or indrawing of the subcostal muscles or the rib cage muscles is actually heart disease. Some of them may have a pneumonia, some of them may have anything else, the heart or pneumonia.
But that is an entry point.
Even a fever can cause fast breathing.
But that's an entry point.
Yes.
So for them to go and do thorough examination of this baby. Okay.
So a baby that is breathing fast, involving other muscles of respiration, and yet they are not hot, they are not having anemia, then you're actually thinking this baby could be having a heart problem.
Wow.
Number 2, if your baby was born at 3 kilograms, and then by the time they are making 4 months, baby is 3 kilograms, then you think that you should suspect that there is a problem.
So not
failure to thrive. We call it failure to thrive.
Or to gain some weight. To
add some weight.
Okay.
So a 3 kilogram baby, a baby will gain about 30 grams per day.
Wow.
In the first 1 month. So by the time they are 1 month, if it was 3 kilograms, they should be about 3.9.
That's right.
Kilograms. So if this baby has not gained any weight, then you're actually thinking that this baby could actually have a hole in the heart.
Wow.
And especially in the lower chambers or the other vessel that I told you that didn't close. For the holes in the upper chambers of the heart, those don't usually manifest that early. They would only manifest early if the connections of the pulmonary veins, are those blood vessels that bring back oxygenated blood to the left side of the heart.
Yes.
So if they don't connect well into the left chamber of the heart, the upper chamber of the heart, and they instead drain, because that can also go wrong, and they drain to the mother, the VHTs, the voluntary health workers in the community can identify. And actually for rheumatic heart disease, we usually want to use the community.
Okay.
The church, the mosques, we want to use the teachers, because they're the ones that have these children in schools.
Okay.
You know, those are the ones that will notice. So if you notice the child you're teaching, teacher, and this child has a sore throat, they can't swallow, they're feeling pain, you should advise the parents to have this child treated early, so that you know a simple sore throat may not just be a simple sore throat. It can end up as a valvular heart disease. or a disease of the doors of the heart, as I usually say.
Okay.
Yeah.
Is there hope? This disease is manageable, or once I realize I have a problem with my baby's heart, that is the end of it for me?
There is hope,
Okay.
Gavin. There is hope. And one thing I forgot to mention, that those are just the structural diseases, but they're also diseases of rhythm, of heartbeat. Is it too fast? Is it too slow? Somebody will ask that. The baby's heartbeat is slow, or we call it a congenital heart block. The electricity doesn't go through this heart well, or when the electricity goes through this heart, it is too fast, to the rate of 250. Which an adult cannot sustain, you know. So they may have those things, but there is treatment. True, there is treatment.
In Uganda?
Yes, of course.
Okay.
Yes, of course. And at all levels. For the rheumatic heart disease, one of the treatments is to treat the sore throat. Okay. Once you've recognized it, treat the sore throat and then prevent rheumatic fever. But if this child presents with rheumatic fever, which is the joint pains, swelling, and quick heartbeats, you know, there's a way we recognize rheumatic fever. And if you identify that this child could probably have rheumatic fever, the joints are paining, the child is limping, or the child's handwriting has changed, I forgot to mention that sign. Because sometimes the children are actually punished for breaking cups. But because they have what we call chorea, it's an abnormal, we call it the St. Sydenham chorea. It's like a St. Vitus dance. They dance in a certain way. They are clumsy. Whatever they hold is falling. The teacher in class will recognize change in handwriting. Pencils are falling off their hands, you know. So if they have that, then they can actually be treated early. With rheumatic fever, we have the drugs, and it's an injectable form. So it's a single shot of an injection we call benzathine penicillin, which can be given at any health center. Any health center in upcountry, but it has to be given in the right way. Now, previously, people thought that benzathine penicillin is only used for treating syphilis, as you know. And when we would prescribe this drug, we just prescribe it for parents up country, they get back. Some health workers would not want to give it. So they're getting diseases of the prostitutes, of the harlots, of sex workers, so they would think that way. So now I just want to raise this voice again, that benzathine penicillin is not only treating syphilis, but we use it to treat and prevent rheumatic fever and also treat rheumatic heart disease. So you prevent that from progressing. For the congenital heart diseases, you can operate those, and those are operated in Uganda. Of course, we still have the 15%, like the babies that are born, say, with 3 chambers, and the whole, say, left side did not grow. So if that left side didn't grow, they don't have a left chamber down, even the aorta, the main blood vessel, didn't develop. Those we actually are not able to handle at the moment because it's a 3-stage surgery. And but if they were recognized early in the fetus, then the family can plan. So if you do a fetal cardiac echo, you pick it up early. Then this family is told early that, you know, well, you're carrying a pregnancy, but this baby has 3 chambers, or the entire left side did not grow. So that even when the mother gives birth to this baby, they know the outcome. That, well, my baby may not live long unless I deliver in a place that I'm able to have, say, the 3-stage surgeries.
Amazing. So actually, treatment is very possible. That's what our guest tonight is telling us. So in case you're told in a hospital that your son or daughter has got a heart problem, it's not the end of the world. We have quite a number of specialists in the country that can be able to help to restore the health of our children. We're going to take a pause right now. We will be back in a moment. Keep sharing the link with your friends and family, the Doctalk Show on YouTube and Facebook as well. Special thanks to National Medical Stores who are making this show available to us, as well as Camelin Men's Collection for your gents' suits and all manner of clothes. We'll be back in a minute.
The Ministry of Health informs the general public that during this COVID-19 pandemic, we should not forget to take our children for immunization. Parents and caregivers are reminded that the immunization services are still accessible at all government health facilities. Please take your child for immunization on time. All vaccines are safe, effective, and free. Remember to observe the COVID-19 prevention measures as you go for immunization services. Wear a mask properly, covering your mouth and nose. Wash your hands regularly with soap and clean water or use an alcohol-based sanitizer. Maintain a physical distance of at least 2 meters from others and avoid crowds. This message is from the Ministry of Health with support from partners.
You are watching the Doctalk Show.
Welcome to the home of our stars. Come on in. We have our movies, gossip, reality, conflict, tulinane comedy. Basirebu baffe bonna live right here. Because no matter where you go, this is the home of our stars.
This year, as Power Magic Mix 3, we are delighted to invite you to see, experience, and celebrate with us. Power Magic, the home of our stars. Multi-Choice Uganda is regulated by the Uganda Communications Commission.
You are watching the Doctalk Show.
Thank you for keeping it here with us. And I hope you are about 40 minutes richer with information about hearts and the children, what to look out for and what to tell your neighbor or your relative concerning the hearts of their children. Yes, those who have just joined us, we are here with Dr. Judith Namuyonga, a pediatric cardiologist working with Uganda Heart Institute, and she's been telling us quite very fascinating information about the heart and the children. Before we broke off, you had given us treatment of some conditions.
Yeah.
I know one of the common things, I've seen a number of fundraising drives, issues to do with hearts, holes in the heart for children. Are all holes treated by surgery in the heart?
Thanks for asking that question. So not all holes are treated by surgery.
Okay.
I must say that it will depend on the size of the hole. So there are holes that are small that should never be operated.
Okay.
But that has to come from a specialist.
Okay.
That will tell you. Not everyone should tell
It's a
you.
specialist to make that decision. It's not a personal decision.
Yes, it's the cardiologist that should make that decision.
Okay.
And if it's an adult that has a certain hole in the heart, then it should also come from a specialist of adults that has experience in congenital heart disease, what we call adult congenital.
Wow.
But in our country, most of
Adult congenital. That means one can be born with a heart defect and then they grow with it without a problem.
Exactly.
Interesting.
Exactly. We've seen people that have been diagnosed with congenital heart disease as they're giving birth to their first child.
Wow.
Yeah, and those mothers would present in heart failure, body swelling, and even the children, some of them, the adolescents. At university, 20-year-olds, 18-year-olds may present with swelling of their lower limbs, as well as the little children, especially when they get into heart failure. So one way to tell that this person could actually have heart disease is by body swelling.
Okay.
Swelling of the legs, swelling sometimes of the eyes, the hands, and at the extreme they get abdominal swelling when the liver is also congested or swollen. So not all holes are operable.
Okay.
So the small holes, as I said, the decision will come from the specialist. Number two, moderately sized holes that are in places, say, in the upper chambers of the heart,
Okay.
or in the lower chambers of the heart, could either be closed by a device without having to open up somebody's heart.
Wow.
So they do what we call catheterization. So they pass wires or tubes through the blood vessels that are in the groin and push those wires into the heart with a small device. So the device is loaded onto that wire,
Okay.
and then the interventionist, that cardiologist is called an interventionist,
Okay.
loads that device and closes up that hole.
Do we have that in Uganda?
Yes, we do. It's been running
Amazing.
for, I think, 10 years.
Oh,
I think it
Interesting.
has. We have a cath lab, and it's done in a catheterization lab.
Okay.
So that can be closer. Now many catheterization labs are coming up. Initially, we only had at the Uganda Heart Institute. So now there are cath labs in several places. So the interventionist will close that hole. I must tell you that one of my relatives was born with a hole in the heart. And while in medical school, I would listen each time. And one time this young person collapsed and so everyone was saying, it must be the heart. You know, whenever you have a diagnosis of the heart, it sends panic into the whole society.
Sure.
But not all heart issues should actually send panic. People should not run around panicking. There are small holes that one can live with without any intervention. And then for the bigger holes, they close the holes either by open heart surgery and other complex heart diseases. As I said, there are those 15% we may not actually do that require 3 stages: immediate newborn, and there are also interventions you do for fetus. But that we do not have as yet
in Uganda.
Yes.
But I know we are moving there.
Yes.
Little by little.
Yeah.
Yeah, we've seen quite a lot today about the heart, the various conditions, the treatment, the presentations. How do we prevent these conditions? I know while you are presenting, you really hinted a number of important things. Antenatal care cannot be overemphasized.
Yeah.
Very, very important. Yeah. As long as you know you suspect maybe by missing your periods, let's go to the hospital. Let's start the antenatal care. Yeah. What are other ways through which the Ugandans watching us, mothers, especially actually its parents, maybe little for the children? It's usually us who are supposed to help in the prevention of this. What other things can we say they should measures to prevent these diseases?
So I will re-emphasize the role of folic acid, the tablets. So start your folic acid 3 months before you're pregnant.
Wow.
As you plan. And if you know you've had a child that has had a complex heart disease, maybe some of the vessels are narrow, especially the blue diseases. They are complex 3-chambered hearts, maybe a child with a chromosomal problem, you want to have a fetal cardiac echo done. And done quite well, because now we can actually identify initially, even just by the biophysical profile team, they would pick up to about 40%. But if you take it further with the right specialist, you're able to get up to 70 to 80% and diagnose a fetus with congenital heart disease. So you plan better. Number 3, avoid alcohol, smoking, and all those funny drugs. Avoid those. Wow. Have all your pregnancies planned, as we've said. For the health worker, it's important that we recognize acute rheumatic fever and the entire society. Not every fever is malaria. Not every joint pain is malaria. Even just one joint swelling can be rheumatic fever. So have these children screened. We are able to screen, we can screen by echo and look at the heart valves, look at the entire muscle and the squeeze. Even in the era of COVID-19, there are children that actually persist with abnormal heart function, abnormal squeezing of the heart following COVID-19. So it's important, and again, I'll mention the vaccination that government has taken on now. So when they tell you bring your children for vaccination, vaccinate them. Mothers, attend antenatal, and we pray that we shall probably have the rubella vaccine on our national program soon to help with the prevention of some of the congenital heart diseases. Quite
very huge information and very impactful for me as an individual, but I believe for everyone that is listening in or watching us tonight. Usually the last portion of our shows is what we call a call to action to the people watching us, to the policy makers, to the policy implementers concerning children and heart diseases. What would you love our viewers? I know there are politicians watching you tonight. There are decision makers watching you. There are mothers watching you out there. What's those last things you want to share with them before we leave this show?
Thank you, Gavin. My number 1 point would be health education for the entire nation. You know, when Uganda was attacked by the HIV infection, we did a lot of radio talk shows, billboards talking about HIV and how bad it was, prevention, the ABC strategy, I think you remember that, abstinence, be faithful and use a condom. So the same thing and the same strategy would be applied for rheumatic heart disease because it's a purely preventable disease. Like we say, COVID-19 is purely preventable, a disease of mannerisms, touching yourself, hand washing. So rheumatic heart disease in a similar way should be, prevention should be emphasized like we did for HIV.
Wow.
Can we pass on this message? Have dramas by schools. I remember acting in the HIV drama. Today is me, tomorrow is somebody else. It's you and me. Remember those songs. So the same thing is what I would emphasize. The ministry and all the other people that are watching, health workers, stakeholders all over the country and the world that are watching us today, please work with us and let's prevent rheumatic heart disease, a purely preventable disease. Wow. Number 2, early antenatal care. Let's still emphasize this. And when the mothers come, let's have an early scan. Avail it in every unit, in every health center 3s in the country. Have a quick scan. Every trained sonographer or radiographer is able to identify at least that this heart would have, is not having, maybe has a hole or there's something wrong, or even on the fetal heart rate.
Okay.
And the fetal services are now beginning, and we can utilize these. Of course, the other thing that the Uganda Heart Institute is doing is to ensure that we're training more specialists, more cardiovascular specialists, and thanks to the government that gave us the mandate to start the training, because we can't send every specialist out of the country. For instance, taking me away for a whole year means a lot to the Heart Institute, and that costs
Ugandans as well.
Yes, it does cost a lot, and it's quite expensive. So if you're not also depending on scholarships, then you can't get everyone.
So you're doing training in at the Uganda Heart Institute?
The Uganda Heart Institute is training
awesome.
Specialists for cardiovascular disease, surgeons, pediatric cardiologists, and the adult team.
Wow.
And we hope that we will be able to take on most of the centers and have somebody for each region.
Amazing, amazing. Parting shots to our viewers.
So, and I still won't fail to emphasize the role of a fetal early recognition of heart issues. I still have to mention that. Who needs the fetal scan? You know, you've had a child with a complex heart disease. Some of them have been diagnosed and they die immediately. You've had, say, repeated abortions, and some of these babies have complex heart diseases that just come out. Please seek care. We'll be able to help you. And thank you so much for having me here.
Wow.
For God and my country.
Amazing. Thank you so much, Dr. Judith Namuyonga, for giving us time this evening to empower us concerning our children and their hearts. You've heard it yourself, and actually you've seen the doctor, and I believe this has been very impactful. Now that you have this information, go out. Don't stay with this information. I always say, you've heard of the Dead Sea. The reason it's dead is because it just keeps receiving, it doesn't let out. Kindly share this information with your friend, with your neighbor, with your uncle, with your auntie. Let's empower one another, and that's how we shall have a healthy Uganda. For God and my country, God bless you. We will see you again next Thursday.
Amen.
Bye for now.
The Doctalk Show.
Bueno, yaba no mojo, yaba no wishi. I don't know. If it is a boy, I'm going to be calling Hakatabas. The garo ret nyana naza kumani mig. Otio, can't take anything grave. Ay. Riama katutumto. Ay. That's one that I'm with you. What yo? You have to look again. Sleep like a baby at home. Yeah. Thank you.
Katoto. Hold on. What about immunization?
No. Nga. Immunization bossy. Into Sakuchikoro one.
Katoto, your son is a citizen of Uganda now. Atogo no mwana witu. Our government has assured that all these essential vaccines, they are free. To us,
You mean immunization is free?
Yes. So we have made sure that there are several health center units where you can take Katabazi and he gets essential vaccines.
You can Before Katabaz reaches the age of 13, he will need to receive immunity against polio. Polio? Whooping cough. Tetanus, measles. Yamawe, measles, hepatitis, influenza. No. The government will even support you by giving you free mosquito nets to help fight against malaria. Yes. Amurre Maura, down the corner. Yeah, tunga immunization.
This week on UBC.